As I mentioned before, discharge planning involves the interdisciplinary care or care team. Now, the purpose of this is to prevent fragmentation of care, and this is why IDT rounds or interdisciplinary rounds are created to encourage and foster communication among the healthcare team to provide safe patient discharge. And here, one of the first interventions that we want to do is to encourage or educate the patient on medications with side effects and food and drug interactions. We also want to educate the patient on indicators of infection, such as fever, chills, incisional pain, redness, swelling, and purulent drainage to the ostomy site. Now, with ostomy care, we want to teach the patient to avoid leaks. Oh, sorry, teach the patient to change the pouch regularly and to avoid leaks and skin irritation. We want the skin to be clean and dry before putting on the skin barrier or pouch. Also, we want to avoid heavy lifting, um, more than 10 pounds for the patient for the first 6 weeks or as directed, in promoting rest and activities as tolerated. Now, the rationale would be to avoid strain to the surgical site in the abdominal area and, to give it time to heal and rest and preventing complications such as a hernia. Next, we have the importance of dietary management to promote nutritional and fluid maintenance. We want the patient to or encourage them to eat a balanced diet with small, frequent meals throughout the day. We want to encourage them to drink fluids and get properly hydrated. And also, because they have a colostomy bag, we want them to have or recommend them to have a low fiber, low residue diet to minimize diarrhea, abdominal cramping, and bowel obstruction. Now, the foods you want them to avoid would be, spicy foods or nuts, anything with caffeine, saturated fats, garlic, onion, broccoli, cabbage, and popcorn. Now, we want the patient to avoid these kinds of foods so that we can prevent like a loose stool and excess odor or gas from the pouch. Instead, we want to encourage the patient to have or to eat foods such as bananas, mashed potatoes, and pureed vegetables. Next, we have the intervention for them to care for the incision, dressing changes, and bathing, and also for them um, to encourage the importance of follow-up care with their healthcare provider. Now, this is also important to address any questions or clarify any concerns that they have. And lastly, here I put or as an intervention to have a referral to community resources, and I'm going to show you that in the next slide with ostomy.org. But basically, it's also important to address the patient's psychosocial concerns of the colostomy, especially regarding intimacy with Miss White, and and their body image, and to encourage discussing issues in intimacy with their partner, so that they feel like more confident. They don't feel like as ashamed of having the ostomy in the way, and so that you could um, have them acknowledge their emotions, because they're going to experience emotions such as shock, denial, acknowledgement, and resolution. And you want to just foster that psychosocial awareness so that it'll help with the healing process, and it can boost their confidence as well.